USMLE style question: thoracic aortic aneurysm and cystic medial degeneration. A 25-year-old man presents with palpitations, shortness of breath, and back pain. His family history is significant for early onset cardiovascular disease. His mother died at age 30 from aortic dissection. On physical exam, he is tall with long limbs, hypermobile joints, and a high arched palate. His blood pressure is 135/85 millifrans. A chest X-ray reveals a widened mediastinum. Further imaging with CT angiography confirms a large thoracic aortic aneurysm. Which of the following histopathological findings is most likely in this patient's aorta? A. Necrotizing vasculitis of the vasa vasorum. B. Abnormal smooth muscle cell proliferation and fibrosis in the intima. C. Cystic degeneration of the medial layer with fragmentation of elastic fibers. D. Calcification of the tunica media. E. Neointimal hyperplasia due to chronic atherosclerotic plaque rupture. Answer: C. Cystic degeneration of the medial layer with fragmentation of elastic fibers. Explanation: this young man is presenting with thoracic aortic aneurysm and features suggestive of Marfan syndrome, which is characterized by cystic medial degeneration of the aortic wall. Marfan syndrome is caused by a mutation in the fibrillin-1 gene, FBN1C, leading to abnormalities in the extracellular matrix, particularly affecting the elastic fibers in the media of the aorta. This results in the cystic degeneration of the medial layer and causes the aorta to be prone to dilation and aneurysm formation. Histopathology of cystic medial degeneration: fragmentation of elastic fibers in the aortic media. Cystic spaces develop in the medial layer due to degradation of the extracellular matrix. Increased risk of aortic dissection and rupture, particularly in the ascending aorta. Why the other answers are incorrect? A. Necrotizing vasculitis of the vasa vasorum. This would be seen in syphilitic aortitis, a cause of aortic aneurysm in adults, but not in this patient with features suggestive of Marfan syndrome. B. Abnormal smooth muscle cell proliferation and fibrosis in the intima, more characteristic of atherosclerosis and atherosclerotic aneurysms, especially in the abdominal aorta. D. Calcification of the tunica media, seen in aging and atherosclerosis, but not in Marfan syndrome or cystic medial degeneration. Neointimal hyperplasia due to chronic atherosclerotic plaque rupture, typically found in atherosclerotic aneurysms and not in the context of Marfan syndrome or cystic medial degeneration. Key takeaways: cystic medial degeneration of the aorta is a hallmark of Marfan syndrome and leads to aortic aneurysms and dissections. Histopathology of cystic medial degeneration shows fragmentation of elastic fibers and cystic spaces in the aortic media. Marfan syndrome presents with tall stature, long limbs, hypermobile joints, and cardiovascular complications like aortic aneurysm and dissection. Aortic dissection can be a complication of cystic medial degeneration, especially in the ascending aorta.